Welcome to This is Getting Old, moving towards an age-friendly world. I'm your host, Melissa Batchelor, and today I'm going to be talking to you about what are the stages of Alzheimer's disease. So I've taken care of thousands of older adults living with Alzheimer's disease, and ultimately you're either going to die with this disease or you're going to die from it. And I hope that this information is going to help you prepare as your loved one moves through the stages of this disease. So there is some variation about how people stage dementia. Sometimes there are like 6 or 7 stages, and I prefer to keep things pretty simple. So it's early, middle, late, or basically mild, moderate, severe. But then also there is ultimately the dying process, which is typically referred to as end stage dementia. The third phase is late stage Alzheimer's, or the severe phase of the disease. And at this stage, the person's going to have severe symptoms and they're going to rely on other people for all of their care. They lose the ability to carry on a conversation. They aren't able to respond to their environment. And eventually they lose the ability to control movement. So common symptoms or difficulties in the late stage include difficulty communicating with words, which leaves their behavior to tell us what they need. And so any bad behavior or challenging behavior needs to be thought of as an unmet need. And what are they trying to communicate to me? They may require around-the-clock assistance, and eventually they're going to lose their ability to walk, sit, and eventually have a hard time swallowing. In fact, about 80% of people in late-stage dementia develop some form of an eating problem. And because of these swallowing problems, they're going to be at higher risk for aspiration or bladder infections or dehydration. In the late stages of the disease, the person's going to have a lot more trouble engaging with the environment or initiating a conversation with you, but they still benefit from interacting with you. So listen to music together, sing together. And the reason that music and singing are well, they can still do that. It's just because that part of the brain is preserved. So music and rhythm are great ways to connect with someone who's very late in this disease. And also to offer reassurance through gentle touch if the person seems anxious or sad. Sometimes, just human contact can soothe and calm them down. But this is also the time that caregivers need to begin to explore community services and supports related to palliative care and hospice care. And if or when the time comes that your loved one is having trouble with swallowing, I recommend that you work with a speech therapist because they can determine what the best type of diet is going to be. Should it be mechanical soft or pureed, or does the person need thickened liquids of some sort? And those things are going to just help decrease the risk of aspiration. And you should also seek the support of a local palliative care provider because they can help guide you through the inevitable end of life that's going to happen with this disease. So far, no one has survived Alzheimer's, so that means it's a terminal illness. And when this happens, it can be a highly emotional time for families. And I just want to make it clear to you that your loved one is not going to die from starvation, that they're going to die from Alzheimer's disease. So think about how nature handles death. Many forms of life just stop eating or drinking when death is near, and it's not a painful process. Feeding tubes aren't recommended in Alzheimer's disease because it is a terminal illness, and evidence has shown us that feeding tubes don't achieve the outcomes that most families want. So they don't decrease your risk for aspiration, they don't improve your quality of life, and in fact, a lot of times they're pulled out, which means you're back in the emergency room or they're back in the hospital due to complications, because it's not normal to have this tube hanging out of your body, and a lot of times they get pulled out. So if you find yourself in this situation of being asked to make a decision about a feeding tube, I'd like for you to learn a little bit more about hand feeding, because hand feeding is recommended over tube feeding until death. And you can offer supportive hand feeding assistance through 3 different techniques that are going to allow you to connect with your loved one. You can offer food and fluids in the safest ways. And you can learn more about these hand feeding techniques by checking out my video called How to Help a Person with Dementia to Eat. And then the final stage is end stage Alzheimer's disease. And this is the dying process. So when we think about end-stage Alzheimer's disease, I wanted to share just some general markers that we use to know if someone is actively dying. And one quick question is to ask your healthcare provider if they will be surprised if your loved one passed away in the next 6 months. The other symptoms include if the person is bedridden, which means they can no longer walk, they can't sit upright anymore, they have absolutely no control of their bowel or bladder, they are having difficulty swallowing food and fluids. And as a result, we're going to see a lot of weight loss and dehydration due to the challenges of eating and drinking. They aren't going to be able to speak more than 6 words to us, and they have another chronic condition like congestive heart failure, cancer, or COPD. That's where it gets tricky. Did the person die from Alzheimer's disease or with it? But certainly having another underlying chronic condition just compounds the problem. And then as people, end up getting a diagnosis of pneumonia or they get septic, if they end up going back and forth to the hospital within a short period of time, then that's another sign that we are probably in the end stage of this disease. So at this point, your providers are going to help you manage any symptoms that you may find to make your loved one comfortable. Your local hospice and palliative care providers can also offer emotional and spiritual support to you to allow a natural death that is both peaceful and comfortable. They can also offer your family assistance with the end-of-life planning, making funeral arrangements, and bereavement support. And what bereavement support means is that they will follow you for up to a year as you go through the grief and loss process. Because when you are grieving the loss of a loved one, you can experience physical, mental, and emotional reactions, and the team can just help you navigate this grief process. So I highly recommend using those services. Alzheimer's disease is one that's going to make all of us take one day at a time and live in the present moment. It can be a very long process, and I hope that this information and these recommendations for finding the support that you're going to need have been helpful. And thank you for listening to this podcast or tuning into the video today.